Today we discuss the topic of depression. Many people suffer from depression silently, are often living in a fear of stigmatization and being branded as mad or demon-possessed. Our panelists here will help us unpack this topic and give some insight and knowledge as professionals and experts in this field so that our viewers can know how to deal with this depression. But before we start our conversation, I want to introduce our panelists. On my extreme left, I have Dr. Thabi Luthuli. She's a medical practitioner and a head of department for health and wellness at GBR. Welcome, Your Excellency. On my immediate left, I have Dr. Matime Diale, also a medical practitioner, and he's a head of department for GBR Health and Wellness Department in South Africa.
Thank you, sir.
Welcome, Your Excellency. And on my immediate right, I have Mrs. Miriam Tefo. She is a medical technologist. Welcome, Your Excellency. She's also a leader of GBR in Pretoria, Zwane, here in South Africa. On my extreme right, I have Mrs. Rachel Zwane. She's a pastor, but she's also a health and wellness consultant and a leader of GBR here in South Africa. Welcome, Your Excellency.
Thank you, Excellency.
Thank you. Welcome. And before we get into it, I'll just give you a minute each to briefly introduce yourself, your experience, where you've worked, what you're doing, your highlights in your career, and your involvement with GBR. Your Excellency.
Thank you, Your Excellency. Hello to the viewers out there today. My name is Dr. Thabi Luthuli. I'm a medical practitioner, have been working as a doctor for about 30 years now. I've worked in South Africa mainly in government positions and also had a private practice. I've got experience in New Zealand for 10 years where I worked part-time as a medical practitioner, mainly GP, and I also specialized in psychiatry, ended up working as a senior medical officer in psychiatry. I continue to have a passion with medicine, and I really am excited about working in partnership with GBR and heading the health and wellness there, because I know that we are going to make a difference in the whole world. Depression exists. It is a silent killer. It is painful to the sufferer and those around them. And around them, it means it includes the whole society. We're looking forward to sharing the nuggets of this illness today.
Thank you very much, Your Excellency. Dr. Diale?
Thank you, Convener. My name is Matime Diale. I'm a healthcare practitioner. I've got 18 years experience doing primary healthcare mostly. And my passion is more around chronic pain. And I also see a lot of patients come with what you call psychosomatic disorders, which depression happen to be the center of the core. And my experience around this thing has been more around social activities, more giving exercise prescription, advising on diets and supplements, and also my advice on referring to qualified psychologists and psychiatrists. And I'm involved in teamwork, and I believe if we have to deal with depression, it has to be an holistic approach, and we have to be very, very fair, because depression, it exists in our society, it exists in our churches, it exists in our synagogues, it exists also in our temple, it also exists in our neighborhood. So it's a scare that we believe that I'll share my knowledge and my experience throughout the program, how we can actually start by destigmatizing depression.
Thank you, Your Excellency. Madam Tefo?
Thank you, Convener. I am Miriam Tefo, and I am a biomedical technologist by profession, and I'm also in private practice. Also, I am a technical assessor. What you do is we go around South Africa to check the competency of all the medical laboratory, if they are releasing quality and reliable results. So we do that through a system. We check personnel, we check equipment that they are using, we check the processes of testing, releasing of results until the doctor gets their results. Thank you.
Thank you very much, Your Excellency. Your Excellency, Madam Rachel?
Thank you, Convener, Your Excellency. As said, I'm Rachel Zwane, a health and wellness practitioner. I just want to draw from my basic experiences as a nurse in primary healthcare clinician. As a primary healthcare nurse, I've been faced with situations of being a first level of consultant. Many clients are coming to the clinics and we are the first people that they have an encounter with. This is very significant because as a first level of consulting these clients, if I fail to make a proper assessment through history and examination and also fail to make a proper diagnosis, it actually means I'll make a referral system to a wrong place. There are situations that I will need to handle myself, and some of the situations I have to refer for opinion, and also I have to make critical decision as to whether this kind of client, possibly that is presenting with headache, is it biological, is it related to depression, and therefore to be able to channel my client specifically for proper intervention. And at the end of the diagnosis of these clients, I'm also responsible to see to their rehabilitation in a primary healthcare center, to be able to see to it that they fit in to the society, and also to give support. And also drawing from my spiritual background, I've always realized the significance of dealing with clients as holistic approach. As convener has said, that also in GBR, we are a holistic organization. And that pushed me further to be able to study theology and to gather skills in theology so as to be able to back up my scientific approach with a spiritual background.
I think that's a very important element you've just mentioned there. The knowledge of God, the spiritual understanding, help the scientific and the medical understanding. And I think I like now and then Dr. Luthuli and Dr. Diale, they speak about this holistic approach to treatment of patients, whatever medical condition they may have.
I think when you talk about depression, we need to define what depression could be. My take on depression definition is that it's a severe illness that is creating dependency and dejection. And it can attack anyone, anytime, anywhere. It doesn't matter your status or your social standing. And many times when you talk about depression, we cannot talk about how it affects your sleeping pattern, your eating pattern, and how do you interact with the society being classified as being depressed. And one of other things, when you look at the literature, we find that depression is something that is very treatable. An 80% rate of success rate using your medicine, using your psychotherapy, and using any other support system that has to support anyone that's suffering from depression. And when you look at depression, there are so many types of depression, but for the sake of this discussion and for the sake of today, I'll only zoom into two types of depression that we see on a daily basis, that we see at our practices. The first one that I need to talk about is called clinical depression. Clinical depression is something that you see when a patient presents on you. But to get to the classical type of depression, you need weeks, you need days, you need months to come to a classical definition of what depression is all about. But clinical depression, it relies on your mood as you come in, it relies on how you talk to us, and also you look at classical things like when you walk into the practice, what is it that you do, and what is it how you interact with us. But a classical thing that when you look at clinical depression, we find that the people are very restless, they feel they are worthless, they feel they are nothing, they are very pessimistic, sometimes they are very fidgety, sometimes they can complain about a meltdown or a slowdown, and sometimes when you start taking history, they start complaining about their appetite. Their appetite can be high, can be low, they can begin to start overeating and they become very obese, which is its own complication down the spiral line. And sometimes when you look at other guys that are eating less, they become very anorexic, and it's common among the teenagers as well. And when you look at depression globally, we know that in South African context, the literature points out in the last consensus that we have for the population, it's about 9.7 people who are living with depression in South Africa. And it's a very, 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 very high number or high figure. And also, when you look at the haves and have-nots within the South African situation, we find that the haves and have-nots, their access to private versus their access to public institution, we found that 80% of those people that have been diagnosed with depression, they access our public institution. And the public institution is already overburdened. And also, when you look at the private sector, there has been a report that came up in 2015 which says that in South Africa, depression is not notifiable, is not registered, and there's also an element of under-reporting and also an element of under-diagnosing as well. So when you deal with depression, there are a lot of social factors that one has to factor in. And when you look at the causes, they are very complex and they are also multifactorial as well. It's not like one blanket fits all. When you look at the symptoms like I've outlined, I think my colleagues will also add on there, is that when you look at depression very, very holistically, you have to understand that a person is not just a physical being, it's also a spiritual being, it's also an emotional being, and also it's also an emotional being. And all those things, when you come to when you do your examination, when you take your history, you consider those factors in. But I must say the classical cause of that, what has been learned from the literature, is that when there's a chemical imbalance in your brain, your neurotransmitters are not firing, they're misfiring. That's when the person becomes very, very much depressed as well. And also, we begin to learn down lately that people who got a history of being abused, whether sexually, whether economically, whether emotionally, when they grow up, they seem to be harboring a lot of bitterness in themselves. They haven't dealt with resolved issues. So therefore, that leads them to depression. Just to come back again, when you talk about types of depression, there's another one that we begin to see a lot at the primary health care, especially in the South African context. It's called postpartum depression. People who become depressed after giving a child, and we say that they are in a blue state. And we know that at some stage in our life, we got our blue days, we got our yellow days, but it begins to bother us as healthcare practitioners when you start camping or we start leaning more towards the blue mood. And that's a concern to us, and that's why we prescribe prescriptions for you. We may advise you to go for exercises. We may refer you to a social worker. We may refer you to a psychiatrist. We may refer you even to a psychologist. So when you look at depression, when you look at it more holistically, it's sort of embracing, it's all encompassing. But the big thing is that what we're facing now as a society is the stigma.
Yes,
the stigma around depression. A lot of people feel that they are bewitched and they feel very weak. And then our advice that those people, when they feel very weak and they feel outside, when they feel like outcast, don't make a judgment. Try and be encompassing.
Is that the reason why people hide? Because they're afraid of being stigmatized.
Yes.
And from what you've said, it seems to me that there are a lot of people who are going out there with depression, suffering from depression, but they don't even know. Or some know, but they hide that. Dr. Luthuli, do you want to come in there?
Yes. I would just like to emphasize that depression exists. Depression is real. Because society doesn't understand or know how to deal with depression, people find it easier to just say, some people would feel that I'm not okay. And I'm saying this because I would like the viewers out there to start thinking about what do we look for to know that there's depression. What can we do? Because when people don't know what to do and they don't know that there's help out there, that's when people hide. Most people would say when they are friends or family members, I'm not okay, I think I'm depressed. They'll just like, it's stress. You know, we've heard a lot of people who say, grow up, toughen up. So it's very important. Here are the basic things that we'd say, start looking out for. Teenagers who start closing themselves in the room, they get in from school or wherever, they just want to be alone. They are irritable. Yes, there's a part of teenage hormones that can cause that, but it doesn't have to be severe. So when you start seeing your child, your mother, people in your community where you're working or at school, change of behavior, they're doing things that you know it's not like them. Most of the time we'll then label people as moody. They are not moody, they cannot control what's happening in their bodies. Because these chemicals in the brain that we call neurotransmitters are up and down. One of the neurotransmitters that is known quite a lot is called serotonin. Most of the treatment will help increase the serotonin. Hence, some people call it the happy pill. Yes, it does make you happy, but it leads to a balanced state of mind. It's very important to understand that. So we'll talk later as we get to the management, how to look after these people, what to do. Everyone, whether illiterate or not, up to the CEOs and professors and the government officials, they need to know this because depression doesn't choose. Anybody can get depressed.
Anyone can be a victim of depression.
Yes.
But what Dr. Diale said that gave me hope was that it is treatable.
Yes.
So at this, that's a glimpse of hope somewhere there. Do you want to come in there? Do you have a...
Yes. I can talk about the one cause of depression, which is unforgiveness. Our physical body a lot of times depends on forgiving other people. Unresolved conflicts sometimes can go deeper, than we may realize, and thereby affecting our physical health. When you are angered and you feel disappointed, you feel discomfort. Sometimes the body takes a burden, that burdens the body. And then during that time, there is numerous things that happens within the body that can cause depression or take the depression level up, including stress and anxiety. So we need to forgive people, and because when you forgive people, their stress level sort of calms down, and then that leads to improve health. So we have to take a conscious decision to let go of the negative feeling, and then also to forgive people, whether we think they deserve our forgiveness or not. And again, as we do that, as we release that feeling of anger, feeling of resentment and hostility, you start to feel that you are emphatic to that person, and you may end up feeling affectionate also to the person that has wronged you.
Yeah, forgiveness is key.
Yes, yes.
So if you harbor resentment, it leads to depression. So it affects you. This is where the spiritual dimension come in. We've got 1 minute for you.
Yes, so thank you, Excellency Convener. Just to add also on the spiritual dimension, basing my facts on World Health Organization, which defines health for us. The World Health Organization tells us that health is a state of complete physical, social, and a psychological well-being, not merely the absence of disease or infirmity. It actually differentiates clearly between disease and infirmity. I'm mentioning this because I'm speaking on spiritual aspect. On spiritual aspect, we see depression as an infirmity. We know that man is a spirit being. He dwells in the body and he has a soul. And this soul component comprises of emotions, the will and the mind. So when you are depressed, the brokenness is on your spirit. And that is what we call infirmity. That is why Jesus Christ has prescribed it to say it is a spirit of heaviness.
Yes.
You are heavy on the inside of you. Yeah. So if we are to deal effectively spiritually, we are to look at causes that makes men to be wounded in the spirit. Things like loss of a loved one, loss of material things, possession, divorce. You have been attached to this person for quite some time. That separation means something in your spirit. So it actually means woundedness, spiritual affliction. And a person who is spiritually afflicted has a detriment towards the mind, the emotions, and the body. Then
that's very, very important. We'll come back to that because the spiritual element is very important, and we've touched on very important points that you have to look holistically at a person. And let us now talk about the severity and emergency management. And also I would like us to look into what steps do you take if you meet a patient that is suicidal and has a recurring suicidal tendencies. And how do we bring holistic management into depression? What's the importance of physical examination and in detecting depression? And the points you've made of the spiritual element, what happens when somebody has lost his loved ones, whether through divorce or passing away, and how do we deal with that? I'll start with Dr. Luthuli.
Yes, thank you, Excellency, and greetings again to the viewers. Most of the time, the doctor or the clinic nurse are the ones who are the first point of call when there's an emergency. What is an emergency in depression? Somebody who's saying, I feel useless, they feel hopeless, they are helpless, and they feel worthless. And they will actually verbalize, most of them, to the families or friends that I am useless to my family and you. I may as well kill myself. Please take somebody who verbalizes such seriously. It's not a matter of laughing about. They are in such a dark place that all they see is death, because for them, death is already here. So committing suicide for them, it's just to finalize getting out of this painful darkness. We are having an increased rate of people who are suicidal, especially within the ages of 18 and 29. Those are the dangerous times. So what does it say to us? Let's give these people, our youth, time and support, mentoring. Let's expose them to positivity, expose them to emotional intelligence, and expose them to support. They need to know they must be supported. But when somebody is set on killing themselves, they are set. And if we don't take them seriously, then we'll find them dead, whichever way. And that's traumatic, even to the people who are still alive. So when somebody talks like that, there are numbers, there are helpline numbers, 24 hours. South Africa, we've got a helpline number. You can Google it direct and find those numbers. SADC has got numbers, 24/7. So you are supported all the time. If it's during the day, take your loved one or your friend or whoever who's verbalizing to the doctor. What do we do as doctors? This is important. Sometimes we think somebody is depressed, whereas there is a cause. For example, not very common, but it happens and we can't afford to miss it. Doing brain scans, exclude a tumor, exclude a bleed or anything that might be happening which is physical. Dementia, our elders, we end up just looking at them as forgetful, therefore they are just slow. They should not be like that. The very common depression amongst the elders, and suicide is increasing. Most of them take their medication, which is for other illnesses. When they come into our practices, most important, yes, is that physical exam, and make sure there's nothing else, and make sure there's no other places in their body where they've injured themselves. Because some would tell you, the pain I feel, I cannot touch it. It's easier for me if I cut myself here and then I feel physical pain. It distracts me from that pain that I can't touch. Let us not be judgmental. It is a painful, silent disease, but as my colleague here said, it is treatable. We admit most of these patients, and there's lots of medical treatment that we give. I won't get specific into it, but once the doctor takes over, then psychiatrists, psychologists, we have a team of medical help. It's not one person. And this is why we always talk about the importance of holistic management. When I was in New Zealand, I'll just touch a little bit about that. When you admitted a patient who had depression or any mental illness, there had to be a pastor immediately at that time. There had to be a cultural facilitator. It might be an elder in your family that you feel comfortable with. Family had to be involved immediately. South Africa, we're growing. Some of it is happening. But through GBR, mental health and wellness, and the holistic way that we really would love to see things happening, there is going to be a boom of the right holistic management. I'd just like to hand over to my colleague, Excellency Miriam, to talk about those blood tests that we have to do at a point just when we admit the patient, to exclude physical illness and other things that might be wrong.
Okay.
Thank you, Dr. Thabi. In the lab, we do various tests. I can mention the first one, which is the thyroid stimulating hormone. It's important to always check the thyroid glands because from that side, the thyroid controls a lot of processes in the body. So it's important to check the thyroid, is it functioning very well? Elevated levels of the thyroid hormone or the reduced level can cause depression. We also check for the full blood count because in there, we are able to detect if there are abnormal cells and also if there is an infection, because infection also can cause somebody to be depressed. We check also the liver function test because also the liver function test, when we have a liver impairment, you can show symptoms similar to that of depression. So we do that just to exclude liver function illnesses. And also the medication that we have, that we give people, depressed people, they are sometimes sensitized in the, metabolized in the liver. So we have to check if the liver is in good shape. Also we do tests that involves the kidneys because also the medication also that we give to depressed people, they can be metabolized in the kidney as well. So we do those round of tests just to exclude other illnesses.
Thank you. That's very, very useful. Dr. Diale?
Thank you, Convener. In addition to what my colleagues has mentioned also, there are usually got a questionnaire that I've designed, and it talks about the biopsychosocial aspect of it, about 10 questions, and I made a patient to fill that up, and at the end I've got a score that I make, and that gives me sort of a baseline that I can work from. But also I become very worried when my patient, they say to me they feel like they're in a dark hole. And when they start mentioning that, I know the severity might be very, very, very severe. And the management also differs. For example, if I classify it as severe depression, then I'll send to hospital for management and for definitive care, and obviously for admission. If it's moderate, then I'll prescribe antidepressants and also send him for psychiatry or for some psychological intervention or social work intervention. And if it's more at a primary level, which I classify more as mild, then I'll sort of give him antidepressant and also give some exercise to do, helping on a diet intervention, and also encourage them that they should go for their spiritual counseling, who they are comfortable with, because I know a lot of churches out there, they've got what you call lay preachers and lay counselors, and I think the services that they can use as well. And also looking at depression, when my patient come to me, they're not responding to headaches, they're not responding to any digestive disorder, they're not responding to any chronic pain, and they begin to start abusing Schedule 5 and Schedule 6 of analgesic. For me, it's a red flag. And I know that the symptoms or the way they present to me is deeper than that. And also the other thing that I look at when they come to me, how they are groomed, how they appear, and basic hygiene standard. Are they maintained? If they're not maintained, then you know that you might be dealing with a dinosaur, you might be dealing with something that is deeper, and you ask yourself, am I equipped to deal with this elephant in a room? Or should I change him down the road to see my psychologist or my psychiatrist as well? And also it's very, very important that you're able to pick up those things. And I think one thing that helps us, it's how you appear to your patient and the rapport you create with your patient. First question when you start seeing them, if you say then to break in the ice, you say, how can I be a servant to you? How can I help you, Lord? That brings a lot of information that's coming from down. If you want to get them away from your office with a wink of an eye, just ask them that, how can I help you while you're here? That creates a bit of an aggression between you and them, and you might lose off things. So it's important as healthcare practitioners how we come across, how we create that rapport, and how we maintain getting that forward. And also understanding the people that you're working around with and people that works with you around. So depression, in all, it needed a holistic approach. You can't do it alone. And it's something that we know it's within our families, it's also within our churches as well. That's why we say we need to zoom in. And when you talk earlier on about stigmatization, my patient also tells me that once they've been diagnosed as a mental health illness, in a South African situation, they're facing what they call 3Ds. The first one is dismissal from work because they just declare themselves that they are mentally unstable. And secondly is discrimination from the society as a whole. They start labeling him, give him some names and making some jokes about him, mocking him or her about her status. And the third D is it's what they call, they become to be disowned. And it's very shocking that when you find out that persons that is being disowned by his own family, his own friends, his own comrade. Earlier I mentioned an example of postpartum depression. A lot of those depression that we see from young girls that have given birth, is that they never had support during their pregnancy. And also on a day of delivery, there's no parent or partner that is there to support them. And also during that period, they have a lot of grief, a lot of unforgiveness, a lot of anger within them as well. And at the same time, it's found out when they come to give them the baby, they don't want even to see that baby. They want to shy away from that. And once they begin to shy away from that, they start realizing that this is overwhelming. All of a sudden, they've got the responsibility 24 hours on the clock. The baby cannot stop crying because he can feel the negative vibe from the mom getting transmitted into the baby. And when they begin to talk about suicidal tendencies, that's when we got our psychiatrists involved. That's when we get our psychologists involved. That's when we got our social workers involved to try and help and alleviate the suffering. And to a certain extent, we usually call the pastors in. It depends on the domination. It depends on your belief system. It depends also how much you relate with the church that you're going to.
And deal with the issue of the spiritual. We'll start with you, Pastor Rachel, as we do the last round, which will be our final round on this topic. If we can just talk about the spiritual interventions, social interventions, psychological interventions that are available out there for people surrounded by depression? And what can the church do? What can society do? What can families do to support those afflicted by depression? And we also need to deal with the other advice that you may have for the people who've got depression, or people living with people that are affected by depression. We'll start with you.
Thank you, Excellency. On the spiritual aspect, there's a very strong interrelationship between the works of the flesh and the bitterness tree of mental illness. Paul speaks to the Galatians church and tells them to say, walk in the spirit so that you should not fulfill the lust of the flesh. For the flesh lusts against the spirit, and the spirit against the flesh, and these two things are contrary, so that you don't do the things that you want to do. I'm mentioning this especially to create some awareness, or to sort of conscientize the church, to say in the way we deal with sickness and infirmity, it is not the same. We see it biblically in the scripture. Jesus Christ never dealt with issues the same. But when we realize what we are doing in the church, it's almost we laying hands on people who are broken. And those kind of people are the kind of people that need to catharsis. They need to speak. They need psychotherapy. They need to express their emotions. They need to be listened to. They need to be supported. It actually means you have to have some spiritual mentor who sits with you so that you can be heard and speak about your pain. Express your emotions. Tell how it is affecting you. And we as pastors and leaders in ministry, it actually means as we are sitting and listening, our intervention will be that of supportive and psychotherapy. And in that way, we'll be able to help these people to come out of deep-rooted bitterness, deep-rooted anger, deep-rooted hostility, and those emotional situations. And therefore, we can be able to make decisions as to, if it's beyond me, there are psychologists, people who are trained further than us pastors, who can be able to sit much more further. Because I do believe that when we are in this situation, your environment affects you. And the most important thing is to be removed from the environment, because a depressed person can harm themselves and begin to harm the people around them. I know of situation of people how they have killed children, people who have, because of poor judgment, have actually given instructions to young boy to do something that is not irrelevant because their judgment is weak. I mean, we are locked outside in your house. There you tell your child, go through the chimney and take the key. You know, the young poor boy doesn't understand because he seems to know that an adult gives right instructions. And he's wondering, how can I go through the chimney to go and fetch the key inside the house? So we have a role to play as a church. And the greatest role is how we deal with infirmity and disease. We cannot mix these two. You cannot lay hands on depression just. Have a time to spend with a depressed person, allow them to speak of their feelings and sort of intervene there based on what the Spirit of the Lord will deposit upon you.
That's very important, that you're giving very good advice, that with people who are depressed, you need time to listen, time to talk, and you don't just lay hands. But in addition to that is that things that are beyond you, you refer to other people who are specialists in those fields, who are trained in understanding those situations. Your Excellency.
Thank you. Another intervention can involve prescribing good food to the patient. If I can mention some vegetables like asparagus and avocado, they're rich in serotonin. Serotonin is a happy hormone. The brain needs that to stabilize the mood. Another veg can be spinach, which has stimulants that can stimulate the brain. We have a food that has amino fatty acids, like a fish. Fish also has that, and then the brain needs fatty acid to function very well. We have also eggs. Eggs also have happy hormones that the body needs to function well. and stabilizing the mood of the patient.
That's very important now to give suggestions about the diet that people who are going through depression can eat. And I think that's very, very important. Dr. Luthuli.
Thank you, and thank you to our colleagues, panelists. So much has been shared, and all of it is important. It's unfortunate we don't have enough time, but I believe that to the viewers out there, this gives you a reason to start finding out more about this. There's Google, there's your doctor, there's your sisters at the clinic. Please continue to find out more about depression and how to manage it. Like we always say, I'll just go back to this so that we always put it in a context. Any illness, be it flu, be it chronic illness, be it a silent killer, there's 4 pillars. Like we've said, you are a spiritual being. Our Excellency has addressed, Excellency Zwane has addressed the spiritual part of it with a biopsychosocial makeup. The biological, we've talked about the body. It's a temple of God. If you look after yourself in terms of nutrition, exercise, and many other interventions at the social level, it will make a big difference. So it doesn't matter what you suffer from. Please remember this. Biological, also biological in that physical, there's medication. It falls under biological. Those are the antidepressant.
Yeah.
So we said biopsychosocial. Social, we've touched a lot on that. The support structures, they are there around you. When all else fails, just go to the hospital or go to the clinic and ask. They've got pamphlets they can give you. Even our government hospitals, it's amazing. We've got the particular specialties like psychologists, psychiatrists. Every specialty is there. Yes, you will queue a long time, but it's just one day. It's worth saving your life that way. I'll touch quickly on the psychological part. Psychology is, there's a wide range of different types of psychotherapy. One of them is just the basic, simple counseling. We catch you early with depression, we're able to start counseling and prevent long-lasting depression. And by the way, if you catch it early, you don't have to take medication for years and years and years. Usually it's about 6 to 2 years. But most people come when it's late, hence it goes on for years and years. And even if you're taking that medication for years, there's other pillars that are not being attended to. So when you do a full comprehensive treatment, it will work. Types of depression, and the most important part, once you are better, you don't stop your medication without your doctor saying so. But also, psychotherapy is excellent. There's one called CBT, where the psychologist will not only help you with medication and treatment of depression, but they'll also follow you up when you are well to prevent a relapse and to maintain that stability so that you don't fall back again.
You had one last point. I want to give the last 2 minutes to Dr. Diale.
Okay. I was just going to add to say, let's be active. Let's be active citizens. That we have a purpose in this life. Let's not be judgmental. The biggest causes of stigma is being judgmental. And after you've been judgmental, you get afflicted with this illness, you go and hide because you remember what you did. But not only that, others judge you too. So as a society in this world, depression is a problem in the whole world. It's not just South Africa. So let us stop being judgmental. Let us look for help.
Thank you very much.
You.
The last 2 minutes is yours, sir.
Thank you, convener. I think depression is very treatable and we got a success rate. And I just want to make an appeal to say that let us begin to evangelize about depression. Let us speak about depression in our churches, in our homes, maybe during dinner on a table. And also, let us destigmatize depression. Because with depression, you can't go anywhere. You know, we need to destigmatize, to unpack that as well. But I think, my take-home message is that let us have support groups in our churches. Let us have support groups in our communities. Let us have our support groups in our schools, in our colleges, and also in our communities where we come in, whether rural or urban as well. And those people that need to shake off a little bit, they need to do some exercises, some form of exercise that I'll recommend highly. Those are aerobic exercises. People must begin to cycle, have a scenery route that I can also make themselves to be very, very, very reasonable. And also people, when they do some exercises, they should do exercise that will make them sweat a little bit. And we know that from the sweating, it releases what you call happy feeling hormones, and they feel good and their body is strong as well. And when you look at exercises also, We must play drum, like, you play your marimba, your percussion as well. Also, it helps to relieve those people that are very depressed as well. And also, when you do exercises, combine them with some bit of a diet, like my sister just mentioned there. One of my favorite diet I prefer is what you call seafood diet. Only carrots that you can get from the backyard. And also, soup kitchen. You can also have your leafy green vegetables also, which are very, very good for your depression as well. They create that euphoria, they create that happy environment. So just in closing, I said, depression is treatable. We can beat this monster that is lying ourselves so that we can create happy families, we can create happy communities, and the gap between the parents and the child, it can be closed up.
Thank you very much, Your Excellencies. This was beautiful. Thank you for availing yourself, for the input, for your advice, for the wisdom that you've shared with our viewers at home. We truly, truly appreciate it. To you, the viewers at home, we thank you very much for tuning in. Please send us your comments and your suggestion and to our website www.globalbusinessroundtable.com, www.globalbusinessroundtable.com. You may also email us or send messages to us at comments@anewthing.tv. comments@anewthing.tv. And those doctors or medical practitioners or health practitioners who want to link up with GBR, please email us as well, because we want to build a very strong network of support system to help people out there with various forms of diseases. Remember at all times to seek first the kingdom of God and his righteousness. All these things shall be added unto you. Matthew 6, verse 33. See you again next time, and God bless.